Advocates are sounding the alarm about the mental health of young people in this country. The situation is getting worse, has been over the past decade. And on this Bell Let's Talk Day, CTV's John Vennavally-Rao digs deeper into this much-needed conversation.
I felt really tired. I felt really unmotivated.
These days, Abby Walker knows all about mental health. But back in grade 10, hidden behind that smile, she felt exhausted all the time.
We didn't talk about mental health. I didn't know that I was struggling with depression. I just thought I was sad, I was unmotivated, and I didn't know why.
At one point, I started hurting myself.
At just 10 years old, Lou Outhoff also felt depressed, anxious, and had thoughts no kid should have.
I was suicidal. I wanted to die, but I'm still here.
Both sharing stories of resilience, hoping to encourage other young people to open up about their own mental health challenges.
1 in 2 youth are struggling with their mental health alone.
A problem that's been growing.
Sadly, we've gone from a situation of bad to worse. The kids are not all right.
Kids around the globe are reporting more anxiety and depression. Some point to lingering effects of the pandemic, others social media and worries about climate change. Thoughts of self-harm are alarmingly common, with suicide the second leading cause of death in this country among youth and young adults. Treatment is in such demand, it can be hard to access.
In provinces like Ontario in particular, kids are waiting on wait lists of 2 years.
And girls are faring worse. A 2023 survey found 19% of boys rated their mental health as fair or poor. For girls, it was 33%. Abby says in university she also developed an eating disorder, but got help and now speaks to others about it.
I started to go to therapy, and that is something that I would advocate for absolutely anybody struggling with disordered eating or an eating disorder.
And Lou is also a big believer in therapy.
It helped so much. I learned so many different coping mechanisms. It was amazing.
Hoping others will start that conversation that could save a life. John Vennavally-Rao, CTV News, Toronto.